So I wanted to discuss the problem of treating comedonal acne in this video, and it's something that eludes a lot of people. People kind of take it in all different directions and try to treat it with the best of intentions. A lot of these treatments backfire, and I wanted to talk about the rationale, what needs to happen with comedonal acne, what's the treatment approach, what the treatment approach should be, what to avoid, and how to address it in the most effective way possible. So let's take a look at the comedonal acne. Comedonal acne is basically the whitehead and blackhead pimples. Those are the basic pimples. They are tiny little holes in the skin or the pores filled up with some sebaceous material, some oily material, some keratin, and those clog up eventually to form whiteheads, as we can see here in the photo. So the blackheads are the open comedones, meaning the pore itself is still open to the outside air, and then when it clogs up and occludes, that forms a closed comedone or a whitehead, which is a misnomer. They're not really whitehead, they're skin color heads. So those are the basic acne. They're the baby pimples. They are the foundation for all other acne lesions. So what we call the pustules, meaning pus-filled pimples, or the red pimples, the erythematous papules, or the nodules, which are the big boils that form on the skin and can potentially be scarring to the skin, can form long-lasting or permanent changes to the skin. So all of these originate in the baby pimples, and the baby pimples are pretty much the most common type of acne that most people experience. They usually occur on the T-zone, they can occur on the nose, on the cheeks, less frequently on the chin, and they can occur on other parts of the body like the back and the chest, but most commonly they're found on the face. So some of the more common approaches to treat acne is to use anti-acne washes like benzoyl peroxide or salicylic acid. Some people use over-the-counter retinoids such as adapalene or Differin. Some people use prescription antibiotic creams and gels and other topical treatments such as clindamycin and benzoyl peroxide. And some people take it up higher to antibiotics. And ultimately, there's always in the background lurking Isotretinoin or Accutane. So let's take a look at what really needs to be treated with baby pimples. So baby pimples, the original sin of baby pimples is dysregulation of keratin formation and dysregulation of oil production. And by dysregulation, I mean they're not produced as normally they would be, and they're not stored as they normally would be. And that leads to those areas just basically accumulating that excess discharge or that excess residue in the blackheads and the whiteheads. So the original sin is dysregulation of production and storage, and the only class of medications that really address that are retinoids. So this is not an inflammatory process, not just yet. It can become easily inflamed and go the inflammatory route, but these are not inflammatory lesions, meaning bacteria are not so much a factor here, meaning all the antibacterials like benzoyl peroxide, clindamycin, all of the prescription grade antibiotics, oral antibiotics, they're not so relevant here because we're not dealing with an inflammatory condition. The other medications that may make a little dent in this are salicylic acid. There are other acids that can make a dent in this, but they're not as effective as the retinoids. The retinoids are the hallmark of treating comedonal acne. They've been that way for over 50 years, and they're very effective at doing this. Now, the real trick about using retinoids is that you really need to, first of all, understand the vehicle that you're using here, meaning you don't want to make it too strong so you irritate your face or dry out your face. You want to be very judicious, very intentional in the way you apply it so you minimize risk and maximize the efficacy. And then you need to be very mindful about the time frame for improvement, sustaining the results, and if unsuccessful, what's your next step? So the retinoid family consists mostly of topical medications, starting with adapalene, which is the milder, the weaker member of the pack, which is now available over the counter in the United States in a gel form, and other forms as well are becoming available. And then there is tretinoin, is the sort of the middle of the pack. It has various strengths. This is a prescription grade medication. It comes in various vehicles, from creams through lotions through gels. And this medication is the mainstay of acne treatment topically for comedonal acne. It works very well. And then there's tazarotene. Tazarotene is a much stronger medication than either adapalene or tretinoin. Comes in a gel and a cream. And this medication has a special category for pregnancy category X, meaning it is teratogenic. Decidedly, it cannot be used if you're planning on becoming pregnant or are pregnant already. You need to stop this product. And generally, by the way, retinoids are not recommended to be used in pregnancy. So let's take a look at the proper application of retinoids, and I'll demonstrate it with my Creamy Carnauba Moisturizing Balm. So this is the tube of the balm. I'm basically going to apply a little bit of that, like a pea-sized amount on my index finger. I'm going to apply this over the forehead, cheek, and chin. And then I'm going to spread it all over the forehead, cheek to nose, and chin. And now I'm going to apply that through another pass, just apply it over the entire face for an even distribution of the medication, and that's it. Voila, you're done. This is the application, the only proper application of retinoids at bedtime. They need to be applied once a day at bedtime. They need to be applied as a pea-sized amount, meaning very, very small amount over the entire face. This way you're maximizing your profits or your benefits from the medication, and you're minimizing your risk of side effects, which are irritation and dryness. Now, why is a retinoid applied over the entire face and not spot treated? The reason is we're treating acne that have not been produced just yet. We're treating the process, the production line underneath the skin where we can't see. So we're targeting specific areas that are known to produce acne, and we're treating the entire area, making sure that the area does not produce pimples anymore. So we're aiming to decrease the production of pimples underneath the skin. It's a pretty complicated process, obviously. Retinoids do that very effectively. So there are several pitfalls to applying retinoids. First of all, the amount of application, then the spot treatment, the temptation to use it as a spot treatment that does not work. It'll actually dry up that area and make it more crazy, more irritable. So you want to avoid that. And then some people forget to use a moisturizer on the face. So you can't actually use a moisturizer on the face if the retinoid dries out your face. And you can actually space out the application from once every day at bedtime to maybe once every other day or once every 2 days for a few weeks until the skin gets used to it. Obviously, do not wash or scrub your face unless you've actually discussed it with your dermatologist and agreed on a reason for washing or scrubbing your face. So don't do any harm, don't undermine your skin, apply the retinoid regularly, and then moisturize as needed. Now, the time frame for improvement for acne from a retinoid treatment is at least 4 to 6 weeks. I usually tell patients I can't take credit for something that happens before, but sometimes it does happen earlier than that. But we're looking at 4 to 6 weeks minimum of consistent improvement in the appearance of things, in the sustainable improvement of the acne. And once that happens, you can still increase the efficacy or the appearance of things. You can still make it better, but it does actually reach a certain plateau and actually flattens out. So the main improvement happens in the first 4 to 6 weeks, can actually happen up to 8. And then at that point, at 8 weeks, you're kind of looking at a plateauing or flattening of the improvement curve. So it's very important to know that you've kind of milked the cow for all it has around the 2.5 month period, sometimes even 3, but no more than 3. So you can't use this medication forever. That's my point. You have to have a clear time frame for improvement, a clear time frame for expectation for this thing to turn around. And if it hasn't turned around, then you need to change your approach. So if your acne has not improved with the topical retinoid that you've chosen to apply, specifically if it's over the counter like adapalene, and now you're moving on to the prescription grade, it's really important to know what your needs and expectations and goals are. So first of all, let's talk about the tolerability of the medication. If you've not tolerated adapalene very well, chances are that you will not do very well on the stronger medications, and that you may get irritated topically, which may prevent you from using the medication in the first place. You may need to tweak your washing practices, your abrasive practices. You may need to tweak the moisturization. You may need to space things out, but you need to fine tune whatever is happening there to make the products more tolerable. And if you can't tolerate them, you're on to the next step, which I'll discuss in a moment. Then again, we need to discuss the needs and the goals here. So if you're looking to control the acne and just do very minimal work, I think the topical medications are just fine. There's nothing wrong with them. However, if you have greater ambitions, you want to get rid of the acne altogether, you want to stop using medications altogether, there's only one solution. And that, by the way, brings me to the solution from the first question of not being able to tolerate topical medications on the face, and that is isotretinoin. So isotretinoin, I've spoken about isotretinoin several times already in videos because it is the subject of much controversy because of its very tight regulation, which I think is arbitrary, and it is the only cure for acne that we know as far as the available prescription medications out there. So it is a very effective medication. The thing that most people don't realize about Accutane is that it is the ultimate medication for comedonal acne. That's what it does. It's a cousin of the topical retinoids. It does actually address much worse acne than comedonal acne, but it can address comedonal acne very effectively. And when does that come in handy? Well, that comes in handy, first of all, in cases where the prescription medications that are topical did not move the needle. If we're not getting any traction with prescription medications, if you go up as far as tazarotene, you've not seen this thing budge, the next step is Accutane. It is not antibiotics. Antibiotics are not going to do diddly squat for this, and you need to stop using antibiotics on comedonal acne. They're not going to touch this. Comedonal acne is going to be treated with Accutane very effectively. Some of those treatments take a while to actually turn things around, longer than is usually expected, longer than average, but it does work on those resistant, tough to treat comedonal acne cases. Isotretinoin would be the solution. Other problems that Accutane solves is the constant need of using medications. So if you want to stop using medications, if you're done with using prescription medications for your acne and you want a shot at treating the acne, making it go away completely, Accutane is your ticket, and that's what I would use. Another thing to remember is that Accutane can be used in cases where you're not able to tolerate topical medications. I know it's pretty rare that you can't tolerate anything and nothing brings you relief, but for those people with very sensitive skin that cannot tolerate topical retinoids, that cannot sustainably treat themselves with topical retinoids and do have comedonal acne, Accutane is going to be their solution. It will dry up their skin, but it's going to be more tolerable than a topical would with potential irritation as opposed to the mere dryness that Accutane induces. So in summary, comedonal acne or baby pimples, the whiteheads and the blackheads, need to be treated to treat the underlying cause, which is dysregulation of keratin production, dysregulation of lipid production. These are not inflammatory lesions. They need to be treated by medications that actually address the underlying processes. The most common category for use against comedonal acne are retinoids. You can go all the way from the very gentle adapalene through retinoids like tretinoin, and then go all the way up to tazarotene topically. And if all else fails, or you have bigger, brighter goals like clearing your acne right off the bat, you're tired of using medications, you can go to isotretinoin and use that as your ultimate acne buster, especially when dealing with comedonal acne. If you enjoyed this video, please hit the like and subscribe button, share it with the people you love, put some comments in the comments section, tell me what your experience is. Have you been stuck treating your comedonal acne? Has your comedonal acne not worked for you? Thank you for watching, and God bless.